Every pregnancy carries a unique story.
Most antenatal visits appear completely normal.
Important warning signs can be buried within routine clinical data. What if those risks could be identified earlier?
Introducing Nuture, maternal risk intelligence for safer pregnancies.
Using information already collected during routine pregnancy visits.
Nuture analyzes patterns associated with pregnancy complications,
providing clinicians with clear and timely risk assessments,
supporting earlier decisions and closer monitoring.
because early intervention can make a meaningful difference.
Because care doesn't end at the clinic, it continues throughout pregnancy, helping improve outcomes for mothers and babies.
Now, let's see Nuture in action.
Using maternal mortality, ML to prevent maternal mortality. So currently, this is our landing page. So when you come, you click on Get Started. And then we have two portals, the clinician and then the mother. So let's sign up as into the clinician. So the clinician, we trained an ML model using XGBoost. That's a decision tree algorithm. So it collects vitals from patients who we log. So currently we have 4 patients in total. Find out that some have logs, some don't have. So for this demo, we added logs to this particular one, and then these logs are basically visits. Whenever the patient visits, vitals are collected, normal antenatal vitals. So these things are logged here, and then the ML is used to determine. The trained ML is used to determine and then give them a score for risk. And then this score alone is not just going to be meaningful. So we added using Grok via sensory AI. Grok will give you a detailed explanation as to why this person was flagged. So between a score of 1 to 99. So it depends from 70. When you start having a high score, you know you're at risk. So, and then we give a detailed explanation for that using sensory. So currently, this patient, we collected 8 logs on a person. Some of the things that made this patient flagged us: temperature of 78, which is obviously very high. So that's why this patient was. So are some of the things that why this patient was flagged. And then there's a detailed overview as to why this patient was flagged. So we also have a voice assistant here to help with that. So this person doesn't have any log. Whenever he visits.
Good day. I'm Tolu, the Nuture Clinical Voice Assistant. I can register patients, log ANC visits, explain risk scores, or tell you about what Nuture does. How can I help?
So Tolu, tell me about Nuture. So they can add the patient.
Yes, I can add patients. What is the patient's full name and current gestational week?
Right. So she can also add patients. So Tolu, tell me about Nuture. Tell me about Nuture.
Nuture is an early warning system that predicts high-risk pregnancies before complications occur. It uses XGBoost models to score patients for postpartum hemorrhage, preeclampsia, and preterm labor at each antenatal care visit.
All right, Tolu, thank you for your time. So basically, the clinician adds, and then we look into patterns for this, and then we give output. So that's what the clinician side does. And then the mother side, the mothers also have an AI where they can actually, during their pregnancy, can ask questions, any health related questions about them and their babies, whether using text or voice. And also, if they are not feeling too well, can request a doctor or an ambulance for pickup. So still using a text AI for this part, and then the chat is using Grok.
Hello, Mama. Welcome to Nuture AI. I'm here to support you through your pregnancy journey. You can tell me how you're feeling, ask about your appointment, or ask me any question about your health or your baby. How are you doing today?
All right, I'm fine, thank you. So what should I eat today?
I'm happy to hear you're doing fine, Mama. That's a great question. To help me give you the best advice, could you tell me if you have any specific food preferences or if you're experiencing any nausea or cravings today?
Yeah, I want to eat swallow. So which swallow should I eat, considering the fact that I'm pregnant?
Ah, swallow. That's a good choice, Mama. Many pregnant women worry about what to eat. The good news is that most swallows are perfectly fine for you to eat while pregnant. For a healthy pregnancy, it's always good to choose options that are rich in nutrients so you can enjoy your favorite swallow. Just make sure to pair it with a nutritious soup that has plenty of vegetables and a good source of protein like fish or lean meat. Do you have a particular type of swallow in mind that you prefer?
Oh, thank you. So basically, that's what the mother said. So they can ask questions, anything related to their health and that of their babies. So thank you for that.